This week on the BackTable podcast.
The world is made up of two kinds of people, authors and everyone else. Everyone has something important to say, something unique, something special. I think it can be fun. And yeah, I used to say and fantasize, right? If I ever walked away from clinical medicine, I need a clean desk facing a window with a gorgeous view.
That's awesome.
And I just want to sip tea and coffee and just write. But, I got to write something that's a bestseller. Otherwise, it's just weight, another box in the garage.
Hello, everyone, and welcome to the BackTable ENT podcast, where we discuss all things ENT. We bring you the best and brightest in our field with the hope that you can take something from our show to your practice. My name is Gopi Shah. I'm a pediatric ENT, and I have a lovely, wonderful guest today. I have Dr. Julie Wei. She's a pediatric otolaryngologist and the division director for pediatric ENT at Akron Children's Hospital in Ohio. Julie is well known to the BackTable ENT family. She's contributed so much on the guest side and the host side with 10 episodes, from Better Neck Health, episode 64, to Surgical Ergonomics, episode 130, and Mentorship for Wellness, episode 58. She hosted a 4-part well-being series for physicians, episode 90, 91, 92, 93, on coaching physicians through malpractice litigation, financial well-being, navigating disability insurance, to how to take a leave of absence. Julie is an author. She routinely writes for ENT Today and has authored 3 books: A Healthier Way, WEI, and Acid Reflux in Children. And her 3rd book just came out, Safeguarding Physician Wellbeing. And that's what she's here to talk to us about today. Welcome to the show, Julie.
Gopi, thank you. I have been so blessed. You and Aaron have allowed me a space and the opportunity to be a part of BackTable, which has been such a fulfilling and awesome experience for me. So thanks for having me back today. I love seeing you.
I'm so happy you're here, and also everything that you contributed. There's so much. It adds so much, I think, to our content and for our listeners. So for those who may not know you, Julie, can you tell us a little bit about yourself?
I hate to admit to myself because I feel young, sort of, at times, but I'm 54, and
That's young.
You have been such a dear friend to me. You know that my journey has not been easy, and the last several years, especially since the pandemic, there were some specific challenges, right? I write about things I'm enduring where there's no playbook, no clarity on how to navigate these things. Which is so different than learning how to perform otolaryngology procedures and take care of children and their families, right? That I think I got down. I don't know everything, but I think I can do that. But this other stuff that's just going on in the background, is real. So the reality is there was the period where I chose to take an ultimate timeout, the 18 months that I didn't work clinically. That was extremely difficult. And I talk about that in this book, and I share that those were really dark times, and then trying to find a way back into clinical care are challenging too, right? So long story short, this last year has really, I don't even know how to be honest about it. It's been tough because I've been commuting from Orlando to Akron, Ohio. It was a great opportunity, but at the same time, it was our only child's high school senior year. And I'm sure I'm not alone in those who do what it takes to support their family, but this commuting has really been tough. And then I've been dealing with this unusual neuropathy, like severe pain, that I now attribute to a rare reaction, perhaps, after Shingrix vaccine. And it's just stuff that, regardless, I don't want to sidetrack us. It continues to be hard to be a physician who supposedly has a lot of content and knowledge. And yet when you struggle and navigate your own health without clarity, I wish I was better at this, but she's graduated and we're here now.
I hear you. I commute as well, right? I do locums, and so I go back and forth to Atlanta. And so, it takes a toll a little bit on your health, your body, as well as, just kind of, you're away from your family at those times. And it's one of those things, I think, the things that pop up in life, like you can't plan for them, and you can't really teach like how to handle or navigate. Like 10 years from now, this could potentially happen. 15 years from, right? Like you go through residency training, fellowship, and your training, your teaching as well. If you're, working with whether it's APPs, trainees, medical students, and it's not like those things are part of the curriculum, and you know what I mean? So it's hard to kind of, yet with books like Safeguarding Physician Wellbeing, with the content that you contribute, whether it's podcasts, articles, setting up these amazing meetings, conferences, panels, at least provides for a space, where these types of challenges and how people are experiencing them and navigating them can come up. And, at least as somebody in the audience, where you're like, oh, wait, okay, I'm not alone. Like, this is real life, like things happen. And then, hopefully that leads to a culture change or a shift in sort of how we, support each other, because it's a lifelong, right, profession. It's a lifelong career. It's not just these little chunks of time of medical school, residency, fellowship, and, life continues. And there's so much that continues with it that is part of who we are.
And, I'm so grateful. You've been such a supporter and a friend. And I know you have inspired in me all the affirming things that you have said about me and my efforts. I can say the same for you, right? But I know today I'm just excited. I've been asked by others, how do you write a book? I've been approached by many. So I'm so glad you're giving me an opportunity to share that experience.
Yeah. So tell me, sort of what inspired you to write this book? The other two are clinical, and it kind of what you said, like, I know how to take care of patients. I do that well. This one's different, right? Like this one. So talk to me about sort of what inspired you.
Yeah, I really think it's just the book that's been in the making, right? For over a decade, for everything that it's a culmination of the articles I've written, the podcasts, the topics, the panels, and I evolved, right? In 12 years, I'm a very different person than in the very beginning when I recognized my own burnout. And basically, it just kind of dawned on me when I was in rock bottom, when I made a decision, because I didn't know every cell in the body is just like, you're so hurt and broken. You can't, you need just a timeout. And then that was really scary. But I had the gift of time, and not every second of every day is accounted for, and the scarcity of time, and there's just not enough of you to go around, right? What a lot of us feel every day. And I think, I don't even know, this is going to sound really dark, right? There was this thought like, okay, what can I leave with all the efforts I've given? And I've had the privilege of experiencing a variety of activities and learning. If I used to say this to myself, if I got hit by a truck tomorrow and I'm no longer here, what can I leave? What would be really important? That's a summary of everything. So it's not in piecemeal. And I think that's when I said, you know what, there's no better time than now. There's just the strong inner voice that says, you get this out, summarize it all, and that's it. Let it be a single place where it could be a resource for trainees and physicians.
Yeah, that's great. I'm glad that it's a space where you can get your inner voice out, get your thoughts out, be reflective. And it's in a medium which you know how to do well. I mean, this is your third book. Writing is, for some of us, it is not easy. But I want to talk to you a little bit about the title. You use well-being, not burnout, and you use safeguarding. I want you to tell me why you chose well-being, and what do you mean by safeguarding?
It's so faint for me to remember giving my first course at the academy and on burnout back in 2012. That was years before the explosion of articles and books, written by physicians across so many specialties, right? I think what's really sad is since several years ago, I think we know it's an epidemic, and it's almost like a desensitization and frankly, aversion to the term burnout. I've observed part of that reason is the way physicians hear it, we're the problem, right? Not only we're burned out, so we're weaker, we're not resilient, and by the way, do more yoga and you fix it. Keep doing what you're doing and do more, but you fix it. And I just kind of perceive people became desensitized. They didn't do a whole lot. And also the expectation were our own solutions, right? Even though very reputable academics emphasize this is a system problem, right? But I didn't want my audience, no matter what, or colleagues to hear the word and get repulsed. And I can just hear their inner voice when someone says, work-life balance. The inner voice says, with what time? With what time? I'm already exhausted. Like, I can't add one more activity to my day, right? So you're drowning in daily tasks. So well-being, then I learned the wellness and well-being are also two different terms. Well-being is really a more holistic term. It is about how you experience this moment of existence as a human being, and it's every domain. So it took me a long time to figure out. The same time I'm a surgeon, I'm also a mom and a sister. My dad had a total hip replacement in Taipei. I mean, just a week ago, just the stress of being across, the globe and not being there, right? Like everything is happening in real time. I'm not just in one role from 6:30 to 5, and then I transition to another. It's recognizing I am in 6-7 roles all at the same time. And no wonder it feels, kind of crazy sometimes. Bottom line is, I said, you know what? I want to write about how do you help people gain psychological safety. You live your day. Some days are better than others. But when a stressful event, when you lose a loved one, when you have a sentinel event, when you go through a divorce, if you physically are sick, if you have mental health erosion because you're a second victim from a career that is not easy, and if you are sued, what happens to you? So finally, deciding on the title was really tough, right? I came up with 5 or 6 options. I asked my husband, my daughter, my sister, my mother-in-law.
Did ChatGPT have any input?
No. You know what? Shoot. I didn't ask that one. So I asked my literary agent and publisher to rank them. And finally, the reason I chose safeguarding. The definition of safeguarding is protection from harm or damage with an appropriate measure. So this conveyed everything I wanted, which is I want to protect us, right? But at the same time, protection requires action. And when we say appropriate measure, it's sharing with others what I have learned over the decades that's not in a textbook, that's not taught to you as much, that says here's a measure that could potentially mitigate the suffering when you experience something.
No, I love that. I liked safeguarding as well because it's almost like you have it. What you need to protect yourself from all the different domains that you go through in the book, it's inside of you. Like you have what it takes. It's just a matter of getting comfortable, like getting the knowledge, meeting other people, and recognizing that what I might need is different than the person next to me. And you know what I mean? And that's okay.
Absolutely. I think about, how when we're at the hospital, right? You're dealing with a complex patient. We consult 17 services. You know what I mean, right?
Yeah.
Oh, do we consult ID and ophtho? And yet, I think that dawned on me. It took a while to figure out, outside the hospital, when we talk about ourselves, that's what the book highlights, right? You need a whole network. How lucky am I to help myself and my colleague when I have an amazing everything, accountant, an attorney, just somebody who's an expert on mental health, on disability. I mean, the list goes on and on. That's why I made it a checklist approach, right? And it's like not having somebody on speed dial on your phone that you have a trusting relationship with, your financial advisor. So you're making decisions not in your own little silo. I mean, we don't accept that in medicine and surgery. Why would we accept it for our own lives? And I think that's really energized me to go, oh my gosh, I wish I figured this out 20 years ago, right? But hey, better now than never.
So when it talks, what I love is there's a lot of chapters. There's a lot of things that you cover, from financial protection, relationship protection, ergonomics. Specifically, there's you go over signs of carpal tunnel, radiculopathy. Like there's things, hey, what should I be looking for? How's it going to pop up to on-ramping and off-ramping or exiting your career? I mean, this is really, really thought out from sort of the beginning, middle, all the different sort of phases or stages or experiences that we might have over a lifetime with our career in medicine. How did you know what to include? Like, how did you there? Because really, it's so detailed, and you're not going to find all of these topics covered in such a way in a single source. It's pretty awesome. Yeah.
Well, thank you. I think I got to be honest. I write about things that I've endured and experienced. Would I have chosen that for myself? Absolutely not. Did I want to have a frozen shoulder? Did I want degenerative disc? Did I want cervical radiculopathy? No, and no. But since it happened and I had to go through it, to me, what's important is just imagining, knowing I'm not alone, right? Maybe somebody isn't experiencing all of it, but they're experiencing something at some point. And I knew that to be true when I helped to launch an ACGME wellbeing program for residents, when I had, in my last organization, became kind of the antenna and very humbled as the go-to person for colleagues when they were suffering. And so the things I write about are not only what I went through, but so many stories of colleagues who were struggling. So that was easy. I know what to write about. Now, some of the things that are harder, on-ramping, off-ramping, for me, it's taking the time out, going back in. But when it comes to early retirement, I haven't experienced that. Lucky for me, I haven't experienced divorce. But I think that's how I just decided. I'm sure there's some things I didn't include, but for everything that I wish, if I was going through residency or even medical school, that I had a chance to read and just to go, oh, I didn't know that existed, or I didn't know that could happen. I didn't know I'm a human being. I didn't know my joints could go out. I didn't know I could have, I could have pain, and I just didn't know. Maybe, I don't know. So yeah, hope that answers your question about what to include.
And what else I liked about it was at the end of each chapter, there's checklists. It's like, I loved it because, you might have the chapter on financial protection, and at the end, it's going to have maybe 10, 15 bullets of things that summarizes or things that I need to, hey, remember these points. And I love checklists because it's something that we're so used to, right? I had a checklist when I was an intern, right? Each patient had a checklist of things that I needed to check or to do. And we have checklists in the OR, right?
Yes.
Before we begin a case. Like, how did you decide to come up with a checklist as part of the end of the chapters? I thought it was great. I think it's a great tool in the book.
Thank you. It was inspired, right, by Atul Gawande's checklist manifesto. And when I learned about his influence and how the WHO kind of mandated that pre-incision for the sake of making sure patients are safe, so we're not taking out wrong limbs, and we're these stories you hear, right? Because we're humans, and then understanding how that transformed the aviation industry after the most disastrous crash and lives claimed. And so I think it dawned on me, you go to a talk and someone's talking about burnout and well-being, and the whole thing is, what are you leaving that content? What is actionable that in the very busy physicians, surgeons who are just, sometimes you're thriving, but a lot of times people feel they're barely treading water. What can you give them that, hey, maybe someone has my book in the bathroom. I hate to say it. You get 5-10 minutes, you flip open a chapter, you digest something on a list. So I'm so glad you asked, right? Because I think you and I and many others probably have a to-do list. You mentioned to-do lists, and I'm compulsive. I have a to-do list on my phone, and it's really kind of a list to reduce my anxiety because I just feel there's so much to do, right? We're not interns anymore. And the to-do list, sometimes the difference is I didn't want mine to, it's sort of a to-do list, but there's an important distinction. My to-do lists oftentimes don't have a deadline, right? Pick up groceries, call the insurance company, do this. It doesn't say by 8 a.m. tomorrow. So sometimes it's just to organize my thoughts during insomnia or whatever. When it comes to protecting a physician surgeon from the greatest harm, risk, and devastating stuff, especially professionally, it's a checklist because checklist implies actions are necessary and critical. And hopefully it's systematic and not just subjective to do, right? Because left to the physicians, we weren't doing a lot of things we weren't taught to. It wasn't on my to-do list to find an incredible financial advisor, to know a phenomenal psychologist. Yeah, I hope that answers it.
It does. When you explain it that way, it makes a lot of sense. And, again, checklists it's something that we're just, the word and how to do that, how to utilize it, it's very relatable in medicine, especially in surgery. And so I just was like, oh, that's so smart. I love that. And like you sometimes want to look at the back of the book, look at the checklist. You might want to then go read deeper or read the chapter and be like, okay, how do I help myself summarize this? So it's very helpful. I wanted to talk to you about the voice of the book, and you alluded to it earlier about, right from what I know, but it's a lot of first person. It is first person, and your voice I can hear it when I'm reading it. So it was great. 'Cause I'm like, I'm listening to Julie. Like, how did you decide did you intentionally decide, hey, I'm going to write this in first person, because it has, as much as it is self-development, it's memoir. It has some moments of memoir because there's a lot of personal stories.
Yeah, thanks. I have learned through opportunities to write, whether it's ENT Today or contributing to the bulletin or whatever, and then BackTable podcasts, when we tell our own story, including pain and suffering and trauma, you're validating it. For me, basically, it was just simple. There's no other way than to share and be honest with the reader, right? So my vulnerabilities, hopefully, when applied appropriately in the right format, is my superpower, isn't it? So that the reader, those who are reading, may not be able to relate to it, but the goal is those who are, would, like you said, they don't feel alone. They understand that professional accomplishments and achievements and a resume and a robust CV and many titles and whatever, none of them mitigate risk and pain that we all will endure as humans. So the book is a memoir, but it took many years for me to learn about myself, how the culmination of who I am and how I use those experiences, hopefully, to have more compassion, empathy, awareness, perspective, and respecting differences, and understand when people suffer. I think it's right. The Buddhism teaching is we all suffer, right? That's just how it's part of it. But what can we do to do good in the world, right? I had to learn, and I'm still working on it, my own tendencies and very deeply rooted inner thoughts that drive behaviors that are not healthy, that make me feel the need to prove I'm worth the oxygen I breathe and I'm worth being loved. And then now, just recently, I can articulate that in public, right? That some of the experiences endured as a med student, even in residency, right? When there are experiences where other people tell you you don't belong, you aren't good enough, you believe it. And then you work really hard to prove otherwise, instead of having self-acceptance and compassion and knowing that that's enough, And I think that time out when I'm not a surgeon, I'm not earning like a surgeon, I'm not taking care of patients, and suddenly it's like, I'm not worthwhile. Like, who am I? That period that I would never have chosen for myself was the greatest gift, So yeah, it is a memoir because it's my life.
Yeah. No, it's great. I love the format. As you were writing the book, a lot of it stemmed, or the backbone was your experiences. But were there findings as you were writing the book that by the end of the book you hadn't thought of to include, or findings or recommendations that maybe at the beginning of the book weren't on your radar? What were some of those findings?
Oh, absolutely. This was a several months project, obviously, from conception to the publication. I can tell you that when I first was creating the book proposal, I didn't have a chapter on delayed pregnancy, miscarriage, and fertility, right? And it's just in real time, I had the incredible opportunity to be allowed to moderate a panel that I put together with amazing colleagues who were willing to get up there in public and share the most painful experience that impacts them while they're delivering care to others, right? So I think that one was one where, the chapters were out. I'm like, no, I have to add a chapter on that. I'm sure my book is not exhaustive of all things. I tried, but, I wanted to make sure not only is there, if it's in print, we're giving permission and space to address this topic that historically is not, that is, we suffer in silence. And then how can I include factual information? Because really, to change the culture of surgical training, to be allowed to prioritize self-wellbeing, family planning, all kinds of stuff, then, yeah. So I'll tell you, by the time I finished the project, then you realize, there's so much more I probably should write about, but it had to have an end. And I'm glad the book is not incredibly lengthy, and I hope you found the chapters digestible,
Yeah, no, that, to me, the two chapters that stood out the most was chapter 12 on pregnancy, infertility, and miscarriage. I mean, as a female surgeon, there's a lot that we put on ourselves and what our bodies go through, and it's a lot. And I don't think we know how to talk about it. We don't know how to talk to each other about it. I was in academics in my prior position and, had the pleasure of like working with amazing female residents. Like we had a good group for a long time. Like it was great. But when it came to family planning, all that, and personally experiencing miscarriage and things like that while at work, it just stuff happens. And what you say is keeping the miscarriage a secret does not help with processing your grief or healing. You're not alone. It was so like, you're right. And, you kind of, there's so many things that we suppress or, we don't really know how to express, process. But I'm reading that line, I'm like, oh God, that it's so true. And you're right. You then have it backed up with very factual things about what you may not know about disability insurance. Nobody tells us get that before your pregnancy, right? Like it's almost like this word that we kind of know, kind of tiptoe around. We don't want to discuss. Maybe they don't want to. There's so many things.
Exactly.
It's difficult.
Exactly.
It's hard to have kids. But it's stuff. It's information we have to have, and knowing other people going through it or having people we can relate to, trust, resources, ask questions to, having this chapter. It's in the book I thought was so important and vital. And again, it's hard to find information specific that's well written and that's thoughtful.
You're so kind, but I can tell you a couple of topics I omitted in the book, right? And part of it is I had the gift, shout out to Sonia Malexidae and Triological Society who giving us a panel this year at the CASA meeting in Chicago. And you would have been so proud because I was so proud. Our panel, we included 2 more topics, cryopreservation, which is a true, huge reality that's relevant for so many. And this is based on the ACS support, recognition, saying, listen, choosing a career in surgery should not preclude family planning. We need...
Good for the ACS.
Oh, big time, right?
Yeah.
Feedback, right? It's feedback that somebody out there says, oh my goodness, you tell your stories because it's true, because it happened to you. And really, again, just give permission and cite lots of whatever data is available, the most current data. It's sad that the reality is miscarriage happens to 40% of female otolaryngologists, approximately, right? Is a major complications. And so if you don't know it, you can't try to be aware and try to support, and program directors and colleagues and people understand that the risk in the 3rd trimester is higher. How do we adjust the OR schedule? How do we stop making it like, oh, it's like, right? I'm older. It was are women that question, are women just as good as a surgeon, to have to then biologically have to, right, justify. And I think it's cultural. I have to still act like, despite all the physiologic changes and the risk that I'm carrying, but I need to finish my cases. I can't be any different than anyone else. I can't leave any earlier. I have to, right? Is that ridiculous? I think it's ridiculous.
100%. You're kind of strategically trying to figure out rotation you're going to be on at what trimester or like cases, or when is a good time to step away for a second, especially if you're the senior or junior in the case, depending on what your role is. Like, there's a lot of extra thought that goes into it. And you're kind of doing all this in your head. It would be nice to talk to other people who have gone through it, or, or have a place that may be able to actually have some recommendations or support. So, I remember I was a PGY5, my chief year, when I had my older one. And I remember, that's the time where you're primary on a lot of the head neck cases, the free flaps. And those are great cases. You want to be a part of them. And I remember it was usually when we would resect and send off the margins. That's when I could step away. But to do that, to get to that point, it's several hours, like from, beginning to that point. It's several hours. And I have to say, we are lucky that there are a lot of OR nurses and techs who are predominantly women.
Yes.
Because I do remember when I was at Jeff, the OR techs and nurses, the women there supported me so much because they got it, right? Like, here, Gopi, just take a seat for a second. You're okay. Nobody's like, it's cool. Like, you can take a seat for a second, or, hey, this is a good time to go if you need to use the restroom, whatever. Like, go get a sip of water, go refill. Like, they made it it was like, okay, they're giving me permission to do that, but they
Yes.
also had my back. Like, okay, they'll stand up for me if something.
You point out something really important, right? We don't give ourselves permission, right? So here we are needing others to give us permission. And I want to really highlight, I know for a fact there are a lot of faculty who are men who give you permission, right? I think hopefully the awareness is we normalize it. We respect it's a need. It's not a personal selfish indulgence when you need to pee every 10 minutes in your last trimester. I don't know. My bladder is the size of a walnut.
Right.
I don't know. I should have had a bladder transplant.
Or there's somebody dancing on it too.
But
so
if anyone in the audience, especially a trainee, let's just say that particular attending or the program you're at, this is not the culture, or the traveler nurses don't know you well. They didn't give you permission. I think you and I are inspiring people to say, speak up for yourself, please. You know what? I feel faint. I need to sit. I think I understand that as I became an attending, that felt easier, right? Okay, you guys, I need ice on my neck. I'm going to pass out. I'm getting vagal. I can say that because I'm the attending and I command the room or whatever, right? But we're just trying to tell people, hey, it's okay. Even if you're a trainee, even if you're a surgical technician, doesn't matter, right? It's team-based sport now. We're really doing away with the fear and trepidation and intimidation as the way to train.
Yeah. And honestly, like, nobody's going to take care of you for you. Like, you have to, and it has to, that habit of, okay, I have to, this is sore, this hurts, I need to go to the dentist, right? Those basic things we have to be able to plan and make time for. Like, it's maintaining our health, whether you're the intern or,
Yeah, you brought up something earlier about suppression, right? I have learned the reason we can push through, and as long as we're breathing, right? We have these bragging stories of completing surgeries and finishing clinic despite being sick and febrile. It's because I think physicians, especially surgeons, we suppress any acknowledgement for signals our body gives us, right? And just live in the cognitive. That's the only way to push through. So that's something that if you've been really good at it for 20 years, you're still not listening to your body, right?
It's true. Your habit is to suppress it. We, internalize it, and that's our habit. It's like a reflex.
Yeah, and I have to admit, I've been struggling with daily pain, right? Maybe whatever this is, and yet mornings are my better time, right? My breakfast is coffee, Tylenol, Aleve. But if you're in surgery, at least for a few hours, even if it's there, I know I'm focused on what I'm doing. But it was really getting professional help, right? Somebody who understands physicians and surgeons and recognizing, and it takes a long time to apologize to my body. I don't listen to you. I power through, right? I'm still working on it. I'm not good at it. To not have that dissociation that we were trained to have, that we lived every day, and including exhibiting emotions, this is why I write so much about pain and suffering and grief. Yeah.
Well, it brings me to the other chapter that I thought that really spoke to me that I liked, which was chapter 10, career longevity. It's something that, until you get out and you're out like 3 to 5 years, I don't think we even think about it. Because at a certain point, for me, is within that time frame, I was like, gosh, I don't know if I can keep going the same way in the way in which I'm doing. And, you mentioned sabbaticals, time off, things that are very much part of other fields. But in medicine, it's rarely discussed. And we always have this fear that it's looked down upon. I took about 6 months off with clinical medicine about a year and a half ago. And, it was a time that I needed for myself and my family just to kind of reset. And it was the best thing I ever did. I needed that. But it was a very difficult decision and move to make. There's a lot of anxiety revolved around that. And you mentioned, who am I? Your identity. What am I going to do? Income, this, that, and the other. And it's a lot, but, we don't think about, hey, that's something that I actually need to keep going. Like, this is something that I don't really want to if I don't want to just do this for 3 to 5 years and then be done, like, what do I need to do? And it's going to look different for everybody, right?
Yeah, I'm so glad you can relate to that, right? Because, one of the toughest things, I just happened to have the privilege to serve as president of ASPO. And here I am all the time thinking, are you serious? How can you be the president of ASPO when you're not working? You're not working clinically. Somehow it's like that fact negated, right? 20 years of having practice and even served as a physician leader. It's just imposter syndrome.
Totally.
Yes,
I was doing
big time.
podcasts at that time when I had my clinical pause, and I'm like, should I even be discussing sinus infections that go to the brain? I mean, yeah, because
Yes.
I've taken care, and I continue and so why do we do that to ourselves? Why do we automatically disqualify ourselves? What?
It's not the norm. Who the heck would take a time out? So I'm so glad you appreciated that chapter. Maybe I'm more bold to say that, having experienced it, and try to tell people, you know what, I'm still valuable. I did find a job. Somebody still wants me. I still can make contributions, and I didn't forget how to practice.
Right.
I didn't forget how to do surgery. That's very scary, right, for surgeons. Here's the thing, right? Most universities are doing away with the tenure track business. Most places have you don't hear about sabbaticals anymore, do you, right? If you're not teaching, the traditional academic roles. It just doesn't apply to us. I will say that there are a few colleagues, not many, that I know bravely took a short-term leave to focus on their family, their health. That's why we did that whole episode on how to take leave. So I just feel like we as physicians and surgeons, it will be very difficult to fight your inner voice. You're going to come up with 1,000 reasons why you can't. But if you truly are just exhausted, not finding joy, if things are falling apart in your life, your health, your relationship, then take a time out. It's okay. And that's something that'll be incredibly hard to normalize. Nobody wants that because it's always about the patients, right? What happens if I take a time out? Who's going to see my patients? Oh my gosh, what about the partners? They're going to take more call. I mean, I know that 1,000 reasons why not. And then you sometimes just have to say, you know what? Not going to worry about it. I need to just have some time and say me first. And I really enjoy that time. I got to be a mom in a way that I never experienced. I got to hold a crying child at 3:45 in the afternoon that I would never have been able to do. And I missed out, so it's not an indictment on the reality of U.S. healthcare and the inflexibility that's getting worse and the expectation and pressure to produce that I'm telling you is just going to get worse. But I don't know. I mean, if you don't give yourself permission to take a time out, then, life is a precious gift.
Yeah, no, and it requires self-awareness, right? I don't think that as a field, sometimes I'm like, we're not the most self-aware individual. It takes knowing your needs and knowing yourself and being okay with that. And man, the imposter syndrome, whether you're practicing or whether you're not, or whether you take a break, whether you don't, it's always around us. And it's just at a certain point, it's you know what? I need to just get over myself. This is what it is. This is who I am. This is what I need. This is the decision I'm going to make. This is my choice. And go with it. It's one of those things where you kind of have to keep telling yourself some of that, it's all how we, I don't know, how we frame things, what we tell ourselves. I mean, I think that that's very important. And it's not, we're telling ourselves things that we assume other people are saying about us, right? We have no idea, right? It's just these assumptions and that preys on our insecurities. And I think a lot of it is just, self-awareness and what are your needs?
Wow. Yesterday, I was supporting a colleague friend I hadn't seen for years who just went through some devastating tragedy, right? And I immediately said, hey, just my biggest concern is the immediate rush to go back to work and not processing, right? And I've always thought this. The reason we gravitate towards work, it's sad, but it's completely predictable and it's always there and it's what we know. The idea of not working, having an entire day to sit with your grief and uncertainty, are you kidding? Who would pick that? It's just so much easier to have a busy day and see patients and operate and not deal and address the feelings, the emotions, the pain. So this is really kind of, I think in many ways, what's happened to, the entire generation of physicians and surgeons, right?
No, that's a great point. You mentioned earlier that, the course that you gave in 2012 at the Academy on Wellness or Wellbeing is maybe different than what you're talking about and or reading about or discussing, presenting today. What have you learned about physician well-being today compared to, when you first started doing the work and I would say it's over 10 years ago, because the first time I heard you talk about it was at a COSM in 2009. And I was like, I need to get to know this woman.
Back then, I think the first time I was told I was so courageous, refreshing. They just had never heard somebody, get up there and talk about their suffering and burnout and having dark thoughts, right? I think saying it out loud made me feel safer. I know that sounds crazy, right? Because there's this whole persona of who I am, how productive I was, whether it's academic, and I kind of check all the boxes, right? To be a good faculty, a good person. And I was living a life where my experience was just brutally the negative. Hit menopause at 40, I'm exhausted. It looked so pretty. I had a beautiful family, had a nice house, a car, lacked nothing, right? And yet I didn't want to get out of, so back then, all I could do was just share my reality. 12 years later, now it's not just that, right? Now I'm able to have the context. I went back to get my master's. I'm glad I had time to do homework when the rest of my classmates were working full-time and doing homework. I went back to school so I can really understand the context. And when everybody says it's a systems challenge, but I remember being so angry at everything that's wrong with U.S. healthcare system. But at the end of the day, the reason this book goes back to what you can do as an individual is, please, let's face it, with the current consolidation across all industries, including healthcare, more and more physicians are going to be employed. If you think you're going to influence well-being and wellness, and yes, we've made progress, and a lot of institutions perhaps have a wellness committee. Like, I get those activities, they're well-intended, but from where I sit, it's concerning. It's still very much productivity, financial gains that define and drive everything, right? And we're there. So the book for me was like, you know what? If your employer doesn't give a crap, if the person you report to doesn't even acknowledge burnout, if you're in a system that's worse, that's toxic, if you have so little control, then let me share with you where you can have control, and how do you be brave enough to say, you know what, maybe no. Maybe I need to find a different situation. Maybe I need to spend some time with myself and say, what the heck? I've just been going along with it because it's easy not to deal with uncertainty and ask hard questions about what brings meaning to my life and my day-to-day, and how is this impacting my loved ones? That's the worst part. How is it impacting my loved ones? If you live and work in a toxic environment, toxic culture, you're angry, you're resentful, you're exhausted, what are you bringing home? So anyways, I hope, I just hope the book reaches more people and it's added value. That's all.
Yeah, no, I think you bring up a good point about control, meaning, we do have choices. Sometimes we feel stuck or helpless, or that's just the way it is. I don't have a choice, but there are things that we can choose or decide not to choose. That's still a choice, and that gives you some agency. And it may start and so that you do feel like a little bit of empowerment, right? Like when you can.
You have to, right? Otherwise, there's no hope. It's hopeless. And then.
Yeah.
And then more than ever, we got people retiring early. We have more people doing locum, right, than ever. Yeah, it's tough. But, you and I can talk all day. But I love to talk a little more about the logistics of writing a book, because I get asked about that. Yeah.
Yes. Okay. So let's get into it. What's the first step? Like, how do you even go about thinking about it?
Yeah, thanks. As you mentioned, my very first book was self-published. We took family savings, and it was beautiful. My book was almost £1. I cried the day that it came out, and I held it, right? And probably because there's pictures of Claire. It's very personal, for the public. This go around, I knew I don't want to self-publish. That is something you can do. But as a physician with a message, and I'm competing with so many books out there on burnout, right? There's so many physician coaches. I knew I wanted a publisher, or try to get one that would enhance not only credibility, and I just wanted done more formal. I'm very lucky. Routledge Taylor Francis was my partner. Healthcare related books are a focus and specialty for them. I was lucky to be connected to two individuals that allow me to consider two options. One is a literary agent. So the agent helped me create a very strong book proposal, and then the agent went out to secure a publisher and contract. Versus the other individual is a very successful, well-known writing expert who helps you write, but then they don't help with a publisher or any of that part. And I think for me, I love writing. I didn't think I need help writing. So I chose to have a literary agent. And then the hardest homework I had to do was called a competitive book analysis, right? So my homework was to go on Amazon and read about all these books on physician burnout, read about what the book synopsis was, and then I need to create...
Yeah, it's like your market analysis.
Exactly. And I need to say why my book was different and how I'm addressing a gap. Otherwise, how am I going to get a publisher? So I didn't want a ghostwriter. I was able to write myself. Maybe that's why you hear my voice and first person. And so the book proposal was so eye-opening for me. There were many components. And with it comes the outline of a book. So you can't just go to a publisher and say, hey, I got a great idea, I'm going to write a book. So I think the literary agent helped me really break that out. And it was I'm proud of the proposal. And then you just kind of sit back and I think they pitched it to 6 and no one picked it up. And they pitched to another 6 and until you get picked up. So once I had a publisher, you sign a contract, then I start writing. So this is the challenging part too. But because I had an outline, right, I was able to work on it. I think over 8 months, I worked on it pretty intensely, knowing that I wanted to go back to clinical work. And this was the time to get this done. Then the senior editor forwards to an editorial team. Someone edits every line, every page. In chapter, they send you the queries. Then you answer the queries. And it's a iterative process until it's done.
That's great. The literary agent, you said somebody introduced you to a literary agent. How do you know when you have the right literary agent? Like, it's got to match, no? Or tell me a little bit about that relationship.
Totally. Actually, his name is Ken Lazat. He's wonderful. He's published 9 books himself. This gentleman I met by Zoom because I think he's in Massachusetts. And it's just a conversation. And I got to be honest, he and the lead person in his consulting business, he was so personally invested in physician well-being. That's the part that surprised me. He said, this book is so needed. This book is needed. He's experienced in the literary world, right? He's like, your content is truly something awesome. And he cared. And I thought, well, wow, this guy represents all kinds of authors, books about all kinds of topics. But he just was very enthusiastic. I think that's helpful, right? Instead of just, hey, I'm your literary agent. What can I do for you? I just felt I could talk to him and he gets it. And he was very responsive and answered my questions patiently. And every time I want to set up a Zoom call, I felt the fit. I'm lucky I didn't have to interview or look for 10 different ones to pick one.
Yeah, no, that's cool. Did you have a writing schedule? Like, were you like, okay, from 9 to 12, I'm going to write that? Like, how do you get into the routine and how do you, it's a lot to write.
It is. You know what? I'm so glad you asked. So in 2012, when my first book came out, my husband helped me with a website, right? A Healthier Way Out, my LLC. I was blogging. This is terrible. I had a full-time job. I'm a mom. I was blogging at 5 to 5:45. I can't do that anymore. Schedule-wise, the funny thing is, you probably know this. Remember during the time when you weren't working clinically, it was scary. I didn't know what to do with a calendar that didn't have schedule on it, right? So what I learned, though, is even if I put right 9 to 12, that's not exactly how it is. I can't quite explain it. And maybe for everybody, it's different. There's some days you're in a zone and there's some days you sit there, you just don't feel it. Today's not the day I can do my best work. I did try to block out and do things in chunks. In a couple hours, I need to sit. So between master's homework, efforts for ASPO, I would try to write. Sometimes when the juices are flowing, you just keep going. Yeah, it could be weekends, it could be nights, and certainly helped that I wasn't working full time because I did publish my first book while working full time. Now I look back and I go, that was insanity, right? Contributed to the burnout.
Yeah, I mean enjoying the process. I think, right? It's not just the final product. It's amazing that you have this final product that's so helpful and needed.
Thank you.
The process of being able to spend the time and putting it together how you want to is a gift in itself. And it's good. It's why don't we do this enough, right?
I think it's fun. I hope people who enjoy it would try it. Yeah.
Yeah. Tell me a little bit, how do you get through writer's block? Is that a thing?
Oh, I'm sure it's a thing. And listen, you're not talking to a New York Times bestseller, so please take what I say with a grain of salt, right? This year with commuting, it's harder. When I'm here with Dave, our sweet dog is 12 and a half. We take a walk every morning. That's really important to me to have some time. Sometimes I think you need to make a cup of coffee, get up and walk around, listen to music, look at imagery that's really beautiful. And I have found that when I'm really feeling blocked, I just use bullet points, okay? Doesn't have to be grammatically correct. It's brainstorming. You let the thoughts come out without judgment or trying to organize them or say, is this a good... You just let it, just put down what comes to mind. And then I find that with an outline, it's easier because you can write paragraphs, right? You break down each thought, each point, and elaborate on it. And trust me, you don't like the sentence, you delete it, you rewrite it, and I probably use more words than I needed to. I talk a lot, I write a lot.
And do you have any recommendations for references or resources, in terms of if anybody in our audience does want to write more, whether it's an article for ENT Today to, writing journal articles to, I don't know, fiction, stories, memoirs, other perspective pieces?
Yeah, that should be a chapter in my next book. Resources, I do find this day and age, you can Google, there's YouTube videos, there's a lot, right? Maybe perhaps overwhelming. And then there's ChatGPT that you brought up, right? I don't know that I necessarily have an outline for looking at resources. This is another one of those, just like financial planning, right? I don't know what I'm doing. That's not an area I'm comfortable with. Relying on the literary agent early on to explain to me. I had all kinds of questions. What's the timeline? What's going to happen? What is my financial investment in having a literary agent? What does that look like? Well, how do royalties work? So resources-wise, I think, the logistics really came from both the literary agent, and then once you have a publisher, they have a certain format. It's not like completely negotiable there. But yeah, and then you talk to people. Yeah, so for anyone in the audience listening who is interested, feel free to reach out to me. Happy to connect them with my literary agent and publisher. You can work directly with the publisher without a literary agent. That's the other thing that you should know.
As we start to round things out, Julie, any final pearls, whether it's specific to safeguarding physician well-being, the book, or the process of writing, or just overall well-being?
I want to ask you when your book's coming out.
Oh, girl. I need to be better with writing. I feel like it's just something that is just so hard for me.
You are being hard on yourself.
But
Gopi,
yeah,
you've created space and permission in a whole other realm. You are such a passionate educator. I've read samples of your work. So I think you're right. For a lot of people, I would say in the audience, if you ever thought about writing a book, I don't care if it's fixing a car or gardening or whatever, if you just thought about it, please consider it. Please consider it because it's awesome. And first time you hold it in your own hand with your name on it, it's not ego. It's different. It's just like, oh, I created something and it's so meaningful. So I think I was told by someone once, maybe my literary agent, right? The world is made up of two kinds of people, authors and everyone else. But everyone has something important to say, something unique, something special. I think it can be fun. And yeah, I used to say and fantasize, right? If I ever walked away from clinical medicine, I need a clean desk facing a window with a gorgeous view.
That's awesome.
And I just want to sip tea and coffee and just write. But, I got to write something that's a bestseller. No, otherwise, it's just weight, another box in the garage.
No, I see it. Well, I appreciate how you've used writing, especially as a tool for advocacy, whether it's with articles or perspective pieces in different journals, different forms of media, tech books and textbooks. So I think it's super helpful. For our listeners, please check out Safeguarding Physician Wellbeing. You can order it on Amazon. So do that. It's super helpful. The checklist is awesome at the end of every chapter. And if any of our listeners want to check out any of other Julie's episodes, remember episodes 90, 91, 92, 93 It's a 4-part well-being series for Physician Wellbeing, which is pretty awesome. So check it out. Yeah, I think it's a wrap. Thank you so much, Julie.
Oh, Gopi, it's always great to get to talk to you, right? Because what a gift for me. Thank you so much for the opportunity to share some more about, what we've been through and what we hope will help others, and for highlighting my book.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable ENT on Instagram, LinkedIn, or Twitter. BackTable ENT is hosted by Gopi Shah
and Ashley Agan.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles,
Josh McWhirter,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz, with support from
Taylor Spurgeon Hess.
Social media and PR by Chi Ding.
Administrative support provided by Judy Dela Cruz. Thanks again for listening, and see you next week.